We're going to demonstrate bicycles, a great exercise you can do anytime, maybe right before you go to bed. This is a great exercise for strengthening your core. First, we're going to show you how to do a standard bicycle. Then we'll show you how you can modify this exercise in case you have limited joint range of motion, or maybe you have an acute bleed that we need to accommodate for. Lastly, if you've been doing bicycles for a while, we're going to show you how to make this exercise just a little bit more challenging. Remember though, however you decide to add bicycles into your exercise routine, there should be no pain as you go through the movement. First, Eric is going to show you how to do a standard bicycle. We want to keep a nice tight core, bringing our opposite elbow to our opposite knee. Be sure not to crank on your head as you go through this movement. Now we're going to show you how you can modify this exercise. The first way to do that is again keeping your core nice and tight, but this time we're just going to go side to side. This helps limit the range of motion. Second, you can do another variation on your back by keeping your core nice and tight, but this time you're just going to slide a heel out. Again, this is all about keeping our core nice and tight and a slow, controlled range of motion through our leg. Now we're going to show you how you can make this exercise just a little bit more challenging using a Swiss ball or an exercise ball. This adds a little bit of a stability component, making the exercise harder. Again, you're bringing your opposite elbow to your opposite knee, keeping your core nice and tight, not clinking on that head. Lastly, you can transition onto hands and knees to do what's called a bird dog. Again, we're focusing on a nice tight core, keeping our hips nice and level, reaching one leg and one arm out. As you can see, exercising your core and doing bicycles doesn't have to be that hard. Remember though, however you decide to add these exercises into your routine, there should be no pain as you go through the movement. The resource folder at the top of your screen has a handout to help you create your own personalized exercise routine. Remember, before starting any new exercise routine, you should always consult with your healthcare providers. If you have any pain during the completion of these exercises, please stop and reconsider doing those exercises for today. And if you have soreness following the completion of these exercises, refer back to part 1 and 2 on what is appropriate levels of soreness. Thanks for watching.